Good evening. I am Dr. Nakia Showell-Bart, pediatrician, child health equity researcher, and president of the Alpha Kappa Alpha Sorority Incorporated Upsilon Epsilon Omega chapter, proudly uplifting and empowering the Baltimore County community since 1994. We have partnered with CADE Foundation for the Maryland Reproductive and Maternal Health Equity Summit for several reasons. One, to continue to raise awareness of maternal health conditions that disproportionately affect Black communities across Maryland and across the country. To enrich our understanding of the social risk factors that contribute to reproductive health inequities. And finally, to be part of solution-oriented and inspiring discussions held with local and national thought leaders, including our very own chapter members, CEO of the CADE Foundation, Dr. Camille Hammond, Ms. Makita Scott, Delegate Jennifer White-Holland, and Dr. Crystal Watkins. Such discussions will foster action towards enhancing access to reproductive health services and improving maternal health outcomes. Thank you.
Did you know that 1 in 5 mothers experience a maternal mental health condition and 75% never receive the treatment they need? I'm Dr. Gina McKnight-Smith, president of the Patapsco River, Maryland chapter of the Links Incorporated. Maternal mental health conditions are one of the leading complications of childbirth, and too often they go untreated. In Maryland, we're doing slightly better than the national average, but not by much. Our state received a grade of C on the 2025 Maternal Mental Health State Report Card issued by the Policy Center for Maternal Mental Health. A C means progress, but it also means too many women are still falling through the cracks. We can change that. By raising awareness, asking questions, and holding our leaders accountable, we can make maternal health a priority in Maryland. Because when mothers are healthy, families and communities are stronger.
Good evening. My name is Dr. Simone Gibson. I work here at Morgan State in the School of Education and Urban Studies, and I'm so excited that we have partnered with the CADE Foundation for the Maternal Health Summit, because the conversations that we're going to be having here are ones that, one, we don't have enough in our community, but two, it's important for especially our young folk here on campus to have this information so that they can have the knowledge to plan accordingly. So excited to welcome this conversation to Morgan's campus. Thank you.
Hello, my name is Janelle Rush, and I'm the very proud president of the Alpha Alpha Lambda Omega chapter of Alpha Kappa Alpha Sorority Incorporated, and we are proud to partner with the CADE Foundation for the Maryland Reproductive and Maternal Health Summit. This partnership reflects something deeply important to us, ensuring that women and families have access to the information, resources, and advocacy they need to make informed decisions about their reproductive and maternal health. We are proud to stand alongside the CADE Foundation in this important work and look forward to the continued impact we can make together. Enjoy.
Hello, my name is Devron Senior, pole model for the Baltimore, Maryland alumni chapter of Kappa Alpha Psi Incorporated, home of the 88 Grand Chapter.
Greetings. My name is Josh Crockett. I currently serve as the first vice pole model for the Baltimore, Maryland alumni chapter of Kappa Alpha Psi Fraternity.
And we are proud to partner with the CADE Foundation for the Maryland Reproductive Maternal Health Summit.
Because we know that healthy families are the foundation of healthy communities. Brothers of Kappa Alpha Psi Fraternity Incorporated are committed to being informed and engaged.
And more important, part of the solution for addressing maternal health disparities.
So, from the brothers of the benchmark of Kappa Alpha Psi Fraternity Incorporated,
we say yo.
Hello, my name is Jan Wood Carter, and I serve as president of Alpha Kappa Alpha Sorority Incorporated Epsilon Omega chapter. We are proud to partner with the CADE Foundation for the Maryland Reproductive and Maternal Health Summit because we strongly believe in its mission. Raising awareness, providing meaningful information, and supporting families facing infertility and reproductive health challenges is critically important. Equally vital is our commitment to advocating on their behalf and ensuring their voices are heard.
Good evening, sorors, distinguished guests, and all who have joined us this evening. My name is Terry Scroggins, and I have the honor of serving as the president of the Baltimore Metropolitan Alumni Chapter of Delta Sigma Theta Sorority Incorporated. Guided by our sorority's mission of sisterhood, scholarship, and service, and our steadfast commitment to uplifting communities through public service initiatives, this work is deeply rooted in who we are. We have partnered with the Cade Foundation because of our shared commitment to advancing equitable access to reproductive and maternal health resources, especially for communities that have been historically underserved. This collaboration reflects more than a shared mission. It represents a unified effort to educate, empower, and support individuals and families by addressing disparities in fertility care and maternal health outcomes across Maryland.
Hello, I am Angela Anglin, President of Alpha Kappa Alpha Sorority Incorporated, Alpha Gamma Chi Omega Chapter, serving Capitol Heights, District Heights, Kettering, and Largo in Prince George's County, Maryland.
And I'm Kim Taylor, also a member of Alpha Gamma Chi Omega Chapter. I also serve in Maryland's House of Delegates, representing Prince George's County's District 23.
We are glad to be here today for our third year in a row co-sponsoring this worthy cause with the Cade Foundation and other collaborating organizations. This is the Maryland Maternal Health Summit, and it is so very important and vital to be able to talk about maternal and reproductive health care. And the reason why is because we want to make sure we continue to educate, allow people to make informed decisions, allow people to be able to have safe health care, as well as just making sure that when it comes to health disparities amongst African American women, we are talking about it so people understand how it affects.
Good evening. My name is Dominic Sykes. I serve as the chapter president for the Pi chapter of Omega Psi Phi Fraternity Incorporated here at Morgan State University. And we decided to partner with the Cade Foundation for the Reproductive and Maternal Health Summit because we really feel like it is important to uplift Black women. We feel like it is important to promote womanhood, and us as young Black women are going to do what we can to support those that we came from. Thank you.
I am Delegate Karen Tools, and I am so pleased to support the Maryland Maternal Health Summit. It is a wonderful opportunity for women to get resources, to gain information, just to learn all the important, information there is regarding. And so I am so delighted to be in support of this wonderful summit and ask that you all enjoy and have a great summit.
Hi, my name is Dr. Ivory Lipscomb-Warren, and I'm the president of the Northern Chesapeake Bay, Maryland chapter of the Links Incorporated and the chief operating officer of the Warren Foundation. We are proud to partner with the Cade Foundation for the Maryland Reproductive and Maternal Health Summit because we are committed to ensuring that every woman and every family has access to care, support, and resources they deserve. This work is personal and purposeful, and we stand in advocacy, awareness, and action to help improve outcomes and strengthen families across our communities.
Hi, I'm Rod Harrison. I'm the pastor of Messiah Community Church in Reisterstown, Maryland, and we are proud partners with the Cade Foundation for the Maryland Reproductive and Maternal Health Summit because we believe that building healthy families is core to building healthy communities, and building healthy communities helps us build healthy cities and states and a healthy nation. And so we're delighted, honored, and proud to partner with them.
Good evening. My name is Yvette Hicks, and I'm president of the Baltimore County Commission for Women. And we have partnered with the Cade Foundation for the Maryland Reproductive and Maternal Health Summit. This collaboration reflects our shared commitment to advancing equitable access and high-quality reproductive and maternal health care. Together, we are raising awareness, addressing disparities, and advocating for improved outcomes for women and families across Maryland. Thank you for joining us.
My name is Deirdre Sumter. I am president of Xi Delta Omega Chapter of Alpha Kappa Alpha Sorority Incorporated. Every woman deserves access to safe, equitable, and compassionate maternal health care before, during, and after birth. Xi Delta Omega Chapter is teaming up with the Cade Foundation to make maternal health a priority. A leader in supporting families battling infertility and advocating for reproductive justice. Together, we're amplifying the voices of mothers, demanding policy changes, and creating a pathway for quality care for all. Join us in the movement for maternal rights, because healthy moms mean healthy communities.
Reasons why women may be infertile. And I'll just talk about a few of those reasons. So PCOS, which is polycystic ovary syndrome. This condition is characterized by elevated levels of androgen hormones, or testosterone hormone, and also women who aren't ovulating regularly. So frequently, ladies with PCOS will have issues where they will not get periods regularly. They won't have a period monthly, for example, and their periods can be very unpredictable or sporadic. And often the issue in this setting is that because they aren't ovulating regularly, the egg is not able to be exposed to sperm, or it's difficult to plan when to actually have intercourse because they can't quite tell when the egg is going to be present. Endometriosis is another condition that is quite common and can lead to infertility. Certainly everyone who has endometriosis does not have infertility, but it is more common in women who have endometriosis. Endometriosis is characterized by a tissue that is similar to the lining of the uterus, can be found in places outside of the uterus and in other parts of the pelvis. Unfortunately, people with endometriosis can have significant pelvic pain. And so this can make having intercourse difficult. There also can be a lot of inflammation in the pelvis, and scar tissue can develop. Sometimes women with endometriosis will develop scarring at the fallopian tubes, which makes their fallopian tubes dysfunctional. And so that can lead to infertility in those patients. There are also, and that kind of takes us a little bit to tubal factor infertility. There are various reasons why tubes can become blocked. You definitely need at least one tube open in order to conceive. But if both tubes are blocked, then that can lead to an issue. And even if one tube is blocked, it can decrease a person's ability to get pregnant. And then something else that we hear about, and particularly for women in Black communities, are fibroids. Now, I think it is very important to note that everyone with fibroids does not have infertility. With fibroids, you know how they say with real estate, it's about location, location, location. Fibroids can be similar, and depending on where the fibroids are located, that can give us information about if it's impacting a person's ability to conceive. Certainly fibroids that are inside the cavity of the uterus can decrease the likelihood that pregnancy will occur, whereas fibroids that are limited only to the wall of the uterus, the muscular wall of the uterus, aren't often impacting fertility. So certainly if you have fibroids, it is a reason for you to talk with your gynecologist or talk with your reproductive endocrinology and infertility specialist in order to have an understanding of if these fibroids are negatively impacting your ability to conceive. So the other thing that I wanted to do in the time that I have with you is to just dispel a few very common myths that you may hear about infertility. So the first one is that infertility is the woman's fault. And I'm using the word fault facetiously. That is not true. Most commonly, it is that a third of the time there's an issue with the female partner, a third of the time there's an issue with the male partner, and a third of the time there's an issue with both partners. And so whenever we recommend a workup for infertility, we recommend that both partners get worked up at the same time to not delay any diagnosis. Black women are often hyperfertile. That is also a myth that I think is really important for us to dispel. Black women are not hyperfertile, and infertility is not uncommon in Black women. In fact, there's some good evidence to show that infertility may be more common among Black women than their Caucasian counterparts. And so certainly this old idea that Black women can't have infertility is outdated and harmful. Infertility is uncommon. That is also a myth. In America, about 1 in 8 couples is impacted by infertility, and the WHO put out good information about a year and a half ago that says that worldwide, 1 in 6 couples are impacted by infertility. So please know that you are not alone if you are experiencing this. It's a difficult road to walk down, but you are not alone. This is very common. And then the last myth that I'll mention is that insurance never covers the cost of infertility treatment. And that is also untrue. Unfortunately, insurance mandates are not universal. So there are about 20 states in the union that have some level of insurance mandate that may, for instance, require that insurance do a workup for infertility. Only about 10 of those states require that insurance covers the cost of treatment. Fortunately, we are in a state in Maryland where it is mandated. Now, there are some caveats, of course, and some rules that need to be followed. But because of the advocacy work done by Cade Foundation and others, Maryland was one of the earlier adopters of mandating that health insurance can cover treatments, including up to IVF. So really important that if you are dealing with infertility, that you don't be afraid to get evaluated. The very last myth, I know I just said I would, but the very last myth is that anyone with infertility must have IVF to be treated. That is not true. And depending on the reason for infertility, there may be other options for you. And so please, please, please don't be afraid to get evaluated. You can be armed with knowledge, and that knowledge is power, and it can lead to you being able to fulfill your family in the way that you dream of. Thank you.
Thank you so much, Dr. Plowden. That was excellent information, and I hope that everyone got some encouragement from that you don't have to have fertility treatment, but support is available. So thank you for that. Our next speaker is Dr. Irina Bird, who is the chair of the Department of Obstetrics and Gynecology and Reproductive Sciences at the University of Maryland School of Medicine. She is a nationally recognized leader in maternal fetal medicine, and her work focuses on improving outcomes for high-risk pregnancies, preventing preterm birth, and advancing maternal and fetal health. And if we could spotlight Dr. Bird, that would be great. Dr. Bird brings extensive clinical research and leadership experience to improving care for women and families across Maryland. Dr. Bird?
Thank you. Thank you for the introduction. I just want to say how important the work that Cade Foundation does is for the state of Maryland and nationally. Reproductive rights are legal and human rights regarding the sexual and reproductive health, allowing individuals to decide if, when, and how to have children. And key components are contraception, safe abortion, fertility treatments, maternal care, and freedom from coerced sterilization and contraceptions. And these rights are considered essential for health, privacy, and equality. And that's important to note. I just wanted to tell you a little story. I don't know if slides are available, but if not, I gave them earlier in the chat. But I wanted to tell the story of our department leading the state in making care for missed abortions and et cetera decisions for women. It's called MARCH program, Maryland Abortion and Reproductive Clinical Health Program. Next slide, please. In January 19th, 2023, our governor approved release of funds for expanding abortion training because we realized that folks do want to have safe services available, but there were not enough providers. Next slide, please. And so Maryland Department of Health did release competitive requests for applications. And next slide. And we applied as a department. And next, and here you see Jessica Lee on the right, who's our provider for complex family planning. And you could click next. Sorry. And we put in a grant together with School of Graduate School and University of Maryland, Baltimore, to Maryland Department of Health to train providers, advanced practitioners actually across the state of Maryland to be available for people who would need services for missed abortion, for abortion, for any kind of care that's very important to reproductive health. And next slide. And so we executed a contract with Maryland Department of Health. Next slide. And this is very important work. And this is Governor Moore, who came to one of our trainings for the third cohort of advanced practitioners. Keep going. And when we started 11 months post-award, this is what the training looked like by clinical providers. And next slide, you could see that in 30 months, we've trained advanced practitioners such as midwives, nurse practitioners, to have those skills available for those people who need it in state of Maryland. So next slide. This is a Mobile. I don't know if you could see me in the middle, and Mary Jo Bondi from from School of Graduate School, PA School, and our president of the school. And by that time, we had 10 cohorts, 94 fellows trained, 87 advanced practitioners, 7 MDs. Next slide. And spring 2025, we expanded to offer for credit course for advanced practitioners, again, midwives, et cetera, to have those services available, and they take the standard curriculum and the rotation in the network places such as Planned Parenthood and such. Next slide. And so the providers that are trained, the expansion of counties by 100% from 9 to 18 counties, and most importantly, training for rural health. We have to be talking about all available services for our patients. And I'm very proud of the work that we do for fertility and as well as providing other services that are available for folks who are making choices or are left with choices like missed abortion and they have to be treated. We need to be providing safe treatments. And unfortunately, that is at risk nowadays, and training may be at risk. Next slide. Yeah.
So Dr. Johansson is a nationally recognized neuropsychiatrist, neuroscientist, and leader in advancing equitable health outcomes. She serves as an associate professor at the Johns Hopkins University School of Medicine and has held key clinical leadership roles, including chief of psychiatry at MedStar Harbor Hospital. Her work focuses on the intersection of brain health, mental health, and chronic disease, with a strong emphasis on addressing disparities impacting women and communities of color. Dr. Johansson.
Thank you so much, Dr. Hammond, and I'm just honored to be here with the distinguished panelists and support the Cade Foundation and the work that they do for women and families in the state of Maryland. And I'm here to talk about women's mental health. So whether it's the stress of trying to conceive, managing hormones from pregnancy through menopause, taking care of your own children, or being the auntie in the village, taking care of everyone else's children, or even just trying to make it from hump day Wednesday to Friday. So mental health is really a state of emotional, psychological, and social well-being that really impacts how people think, feel, and behave. And I just want us to have a brief conversation tonight. I'll do an introduction. And really, it involves managing stress, relating to others, making choices, and coping with life's changes. And it's not merely the absence of illness, but really the ability to thrive and reach one's potential, even in the setting of adversity. And so good mental health is really crucial for overall health and well-being. And it really includes that physical health and reducing risk conditions, whether it's some of the stress that can be related to trying to going through infertility or any type of women's health conditions or fibroids or even heart disease and diabetes. And with relation to maternal and fetal health, it really enables individuals to cope with the normal stresses of life and maintain positive relationships. Women, interestingly enough, are often the head of households. And so not only do we spend time taking care of our families and making sure that they're getting their physical health, but a lot of times we're also the ones that are dictating different appointments for people around us. And so sometimes we often neglect ourselves. And so when I think about a picture of what we think about mental health, there's this beautiful poem It's called The Weight She Carries. So just give me a minute. I want to kind of set a picture setting. I'm going to talk about mental health and kind of describe it in this poem, and then talk about some health advocacy that's going on in Maryland related to women's maternal health, and then finally talk about some resources that are there. So it's called The Weight She Carries. She walks with a smile, stitches fine as silk, through the thread phrase under the strain. In her chest, a quiet storm presses against the ribs, each breath a negotiation. The world calls her strong, as if strength were the absence of breaking, as if the night she spends counting the cracks in the ceilings were not part of her courage. Her mind is a room of shifting walls, sometimes wide with light, sometimes closing in until even her own name feels foreign. Yet she rises, not because the pain has gone, but because she has learned to carry it like a hidden river, flowing beneath her days, feeding the roots of a self that still blooms, even in the shadow. And so as Black and brown women, these are the things that we go through each day. We're often the support network for everyone else in the family. And again, with the Kate Foundation and other organizations, it's important for us to be able to lean on each other in order to get through stressful times. One of the things that's very important when we're thinking about mental health is kind of the national programs and looking at maternal mental health. So Maryland really offers a variety of programs. And there's actually been a national maternal health crisis in U.S., and it's really largely been defined by recent increases in maternal mortality. And really, there's stark inequities. Even with highly successful, educated Black and brown women, there are disparities in our health access to healthcare. Geography, your zip code determines your life, your livelihood, and your longevity, and also socioeconomic status. So as recently as August of 2024, the U.S. Surgeon General issued an advisory. It's called Parents Under Pressure, and identifying paternal mental health and well-being as another critical public health challenge, and requiring immediate national attention. And so the advisory really highlights three things. So really rising levels of paternal stress and intergenerational public health impact. So that means, being in that sandwich generation, caring for your parents and also caring for your children and other people around you. And the report offers a new perspective on recent increases in maternal morbidity and mortality. And so Maryland actually has a report card as part of this health policy. And most recently, there was it's called Strides in Maternal Mental Health. And each state was given a grade. And so if you can guess, even though Maryland is, my favorite state and I'm born and raised here, we received a grade of C in 2025. And so that's slightly above the national average, but it means that there's lots of room for improvement and there are things that we can do better. And according to that report card, the score really reflects the state's efforts to support mental health and advocacy. And I know that's one of the things that the Cade Foundation emphasizes. And particularly increasing access to mental health screening is an important part of this. So the three key takeaway points from that maternal mental health report card that our state legislators are initiating programs to help us with. Number one is mental health screening. So the report highlights that Maryland does not require its health plans, especially Medicaid, to look at rates of maternal mental health screening. So this is a new initiative that they're talking about increasing. And advocates argue that improving screening can significantly enhance recovery rates for mothers experiencing mental health issues, especially postpartum. That's the most critical time. You've just delivered your baby, and if you're depressed and you can't take care of yourself, how are you going to take care of your baby? Number two, a legislative efforts. And again, this Maryland Mental Health Act of 2024 aims to improve maternal health outcomes, looking to provide different support systems, resources for high-risk patients, including mental health counseling when necessary, and also mandates that the birthing facility really participates in making sure that mothers have access to mental health care and support. And the third thing is access to services. So Maryland performs better than many states. However, there's also they're trying to have different programs to be able to increase access. And I'll talk about three programs and resources, and I'll include some information for anyone that wants it. But Maryland offers program and resources to support paternal mental health, including hotlines, educational initiatives, and special care for pregnancy women. And there are three programs I want to just mention. One is Healthy New Moms, and this is something run by the Mental Health Association of Maryland, and it focuses on raising awareness of perinatal mood and anxiety disorders. It's a 24/7 hotline. There's the number I'll include in the information, but it's 1-833-943-5746, and it offers educational resources and webinars to help young mothers. The second one is the Maryland Maternal Health Innovation Program, and this aims to improve maternal health across Maryland by coordinating efforts in data collection, professional training, and it's a collaboration between Johns Hopkins University, Maryland Department of Health, and Maryland Patient Center. And the last resource for our listeners is the Women's Mental Health Program. This provides comprehensive evaluations, and it's free for people who do not necessarily have insurance. And then there's also for children, there's the Maternal and Child Health Bureau that's part of the Maryland Department of Health, and it also offers resources for children and families. Thank you very much.
Thank you to the CADE Foundation and our community partners for holding space for this conversation. And it truly is a wonderful transition from what Dr. Watkins shared as the remarks that I will be offering related to one of the core bills that I had the pleasure of championing around perinatal mental health. But in Maryland, as we have heard, we continue to see persistent disparities concerning maternal morbidity and mortality. And unfortunately, they remain unchanged. And it truly is unacceptable for a country like ours to be ranked so poorly from a global level when it comes to maternal health. And so as a new subcommittee chair of the Maternal, Infant, and Child Health Subcommittee in the House of Delegates, it is one of my priorities to address systemic racism and chronic stress, which we know are one of the core drivers to the disparities that we see around maternal morbidity and mortality. And so while I understand that change may take time to see and feel its impacts, the maternal health crisis that has been elevated, it requires us to move with urgency and with intention in the policies that we pass, the funding and the strategic investment that is made and appropriated in our state and local budgets, and also elevating community partners who are often overlooked and who are really helping and healing our mamas and their families. And so this year, I had the pleasure of sponsoring HB 1118, cross-filed in the Senate as Senate Bill 891, entitled Health, Health Insurance, and Health Occupations, Perinatal Mental Health Conditions. This was also a legislative Black Caucus of Maryland priority bill, and it really came out of and was birthed out of my more recent birthing experience, as well as the data that we see in our state. And in October of last year, as I was still recovering from my birthing experience and was in my postpartum journey, I brought together providers, doulas, perinatal mental health professionals, family members, birthing people, health departments, health officers, public health professionals, and other state agencies and advocacy organizations to really come to the table to focus on a bill that would increase access to mental health services and screenings. And we know, based on the data we have in our state, that behavioral health conditions continue to be the leading cause of all pregnancy-associated deaths in Maryland. And so given the data and the need for greater supports in our community, the bill does 5 things. It codifies existing American Academy of Pediatric guidelines for pediatricians to screen moms at well baby visits at months 1, 2, 4, and 6, which follows the Bright Futures guidelines. We know that there are many pediatricians that already do this, but this ensures that a free and validated tool is used during the visit, and that moms and birthing people can be appropriately screened during those well baby visits. If there is a positive screen, the provider will then have a standing referral to ensure that moms are connected to a licensed perinatal mental health provider. Thirdly, patient education is another component, along with the distribution of resources at WIC sites and after well baby visits. And lastly, providers, those that you may have even heard from today, as part of provider training, they will have an opportunity. Those who engage and interact with the perinatal populations may seek perinatal mental health training, which would count towards continuing education units towards license renewal. And so I'm very pleased to share that both of these bills, the Senate and the House versions, have crossed and await the governor's signature. It took a tremendous effort and is only one step that gets us closer to providing the necessary resources and supports for moms in their communities. We know that significant work is still needed, and I look forward to working with all of you to do so. And so here is my call to action to everyone. Number one, it's important to make sure that you know who represents you. It could be me, it could be one of my other colleagues in the House or in the Senate. Number two, it's important for you to reach out to your elected officials and elevate that Black maternal health is a priority for you. Number three, share your ideas and identify champions like myself who may be interested in sponsoring legislation or at least exploring the possibilities of what other solutions as we as a state can pursue, and certainly remain engaged in the policy development and decision-making process. And so with that, I see Dr. Hammond has come on, so I will stop there and look forward to answering any questions and appreciate the opportunity to share this evening.
Thank you so much, Delegate.
50% of infertility cases, right? About 15% of men have varicoceal, and about 40% of men with infertility have it. This is caused by enlarged veins.
Often Black women also present to care at older ages where fertility is already declining and success rates are lower. So having the knowledge about your fertility earlier can get you in front of someone who may be able to help you sooner, and that may be able to turn these numbers around a little bit. So what can be done? Community outreach, which we're doing now, improving your reproductive health literacy. STI prevention is also super important because a lot of tubal disease can come from gonorrhea or chlamydia in our adolescents, and improve provider level education for them to identify people who are at most risk for infertility and providing appropriate referrals. Thank you. That's my
now we have the internet. So now people come and information is important, but when they come with information and you try to explain use your experience to try and speak to them, people don't want to hear. It's difficult. So like I said, I'm taking a little bit of a contrarian view, because my thing is, why won't sometimes our people listen to us? And I've been with the same group since 1996. It is important to pick your doctors carefully. And I know right now people are like, I want somebody who looks like me. Well, there's only so many of us who go to medical school. I went to Yale Medical School. There were 10 of us in that class. There's still 10 of us in the class. And of the 10 of us in the class, how many of us go to OBGYN?
Admittedly, I don't practice OB anymore, but I look at obstetric care as if we have a high-risk pregnancy. So if we have something that may turn into a surgery, i.e. a C-section, or we're having complications, I think that for low-risk pregnancies, a midwife would provide the best experience, and it's really usually a tight-knit bond throughout the pregnancy that if you're in general OBGYN care, you're probably not going to have.
As a community, we don't talk about depression as much. So you have the baby blues, so that can then become postpartum depression. We have just general blues, the little D depression, things happen, but then sometimes after menopause, then we go to the big D depression. So knowing that we have resources and support to be able to talk to each other as sisters and family members to say, hey, it's not just you, you're not just one. Absolutely.
Your hormones drop just like that after you have the baby. So your hormones up.
up and down, right? So you're trying to balance it out, and it's just a matter of it's going to affect each person different. If you're someone that probably already had anxiety prior to the baby, more than likely you're going to have anxiety as well.
Your options are more limited, but really starting to think about your reproductive goals as early as possible and having those conversations with one another openly and often, which we unfortunately don't do as much as we should. So I really want to thank our panelists for just being open and candid and sharing their experiences and expertise with us today, and thank our audience. We have time for one more.
Breathe and to regulate your nervous system and figure out, okay, well, actually I'm feeling pelvic pain, and so I don't really know how to explain it to you except that when I get up and I stand this way, it hurts. And it's like, okay, what does that mean? Unfortunately, in the system, they don't have that much time to sit and dissect everything with you. So having a doula means that there's somebody who can prepare you before appointments and say, how are you feeling? What's going on? Let's talk about this. Have you talked to your mother about this? Have you talked to a grandmother? Do you know maybe some family history that we should bring into context? So when you get to your appointment with your practitioner, you can say, I prepared 5 questions, I talked to these people, and have very specific requests, which allows them to tap into their expertise and say, oh, here's really what we need to talk about.
For maternal health. So we have a path, but this is our time now to really advocate. As you heard Ms. Scott say, we have some things to do and we can do some things. So we chose 3 standout bills. You've already heard about 2 of them. Well, one of them, you heard about the maternal mental health, again, Delegate White Holland's legislation. Emergency pregnancy-related medical conditions. Now hospitals have to screen for that. Again, that's very important, particularly for Black women who are coming in and may not get the recognition that they need. The thing I like about this piece of legislation, and you'll see in the expanded sheet that you all received, is there is a nice fine attached to it if hospitals don't do it. So that gives that teeth, right? So when you talk about legislation, you want to also talk about not the administrative side, you want to talk about the financial side too. We'll talk about that in a few minutes. So someone asked about high school students, and you know, I would say that's a very contentious. I'll just say that, but at least now in community colleges, they have access. Students have access to over-the-counter contraceptive and reproductive health materials, and that's important because community colleges traditionally tend to have more students who are of color, who are older, and who are lower income. So this removes a barrier for it. Another thing that I wanted to bring up, I have some other pieces of legislation that I thought were good. There's one about menopause access, making sure that healthcare insurers have more access for menopause assistance and education. And then there was one that came out of my home county. I too am a native Marylander, Prince George's County. It actually failed, but it failed because of an administrative reason. It was introduced too late. They were trying to designate a healthcare zone. So we heard a lot of discussion from our panelists about not only the actual health, but the food insecurity, the housing insecurity, the education access, and neighborhood and built environment. So that would have designated lower income and health impacted areas in Prince George's County, giving them about $5 million over 2 years to support the economic development and investment of these types of businesses.
76 is tax. It was effective July 1, 2026. That's when it will be effective. This bill requires Maryland community colleges to make all FDA-approved over-the-counter contraceptives available to students through health centers, vending machines, and other campus methods. Community college and public 4-year institutions must report annually to the Maryland Higher Education Commission on how access is provided. The Commission reports findings to the General Assembly each October. Why does this matter? It matters because community college students are disproportionately low-income working adults and students of color, populations with at least flexible schedules and fewest resources to access reproductive health care off campus. In 76. That bill is passed. The first bill I just read to you, that is adopted, so that's on its way.
Your hormones drop just like that after you have the baby. Okay. So your hormones up and down, right? So you're trying to balance it out, and it's just a matter of it's going to affect each person different. If you're someone that probably already had anxiety prior to the baby, more than likely you're going to have anxiety as well.